Washington's been telling you for years that Obamacare is collapsing, and without more subsidies, health premiums will skyrocket. Turns out, though, that isn't true, at least not the way Democrats want you to think it is. New data showing that average marketplace premiums after tax credits will be just $50 a month in 2026. Yet the government is picking up 91% of the cost for the lowest tier plans. Translation, Obamacare isn't failing because taxpayers are paying to keep it afloat. The sticker shock Democrats keep warning about, it's mostly affecting a tiny slice of higher income retirees. That's what gets Dagan all the time about this. Not exactly the working families that they claim to defend. And that is what this government, Kevin, is shut down over right now, amongst other issues regarding Medicaid and illegals. You know, there are separate aspects of it. But Obamacare is not doing well. Taxpayers are on the hook for this in a major way. They don't want to, the Democrats, don't want their pet project to fail, and so they want us to keep subsidizing it. But as Dagan always points out, and she just wants to pull her hair out, it's not like poor people are getting the benefit of that.
Yeah, well, we're not going to solve this by November 15th, I can guarantee you that. Yeah. By the way, every member of the G7 is struggling with health care costs. There's a lot of optimism, though, if you want to look at the shiny side of this. AI may be able to solve a lot of this over the next couple of decades, particularly around data and custom and the actual individual's data and their DNA and what they're prone to disease at and preventative medicine. All this stuff, countries that can afford to do it now, like the UAE and Switzerland, where they only have 7 or 8 million people, they're pouring money into these narratives, and that's working for them around diabetes in the UAE. In Switzerland, they've got a lot of aged people past 80 years old. The promise of AI, and I don't want to be an optimist when the government shut down, we got to fix it, but we're not going to solve health care for the next 10 years. And all we're doing is using taxpayers' dollars going into debt to fund a very inefficient system. I had an MRI when shooting Shark Tank on a herniated disc. I had to bring the actual data on a CD-ROM back because we do not allow the data to cross the country digitally. How stupid is that?
Yeah.
Still can't do it on privacy laws. Stupid, stupid, stupid. And so I'd like to see that fixed.
Okay, a lot of inefficiencies, and you bring up an excellent point, which is we cannot solve this in a quick manner. And so, Gary, we're sitting here in a situation where the Democrats are basically holding a gun to the Republicans' head and saying, if you don't give us what we want, we're going to continue the shutdown. But that speaks so much more about them and their mindset right now and the people who are suffering as a result of it.
Yeah, the blob grows bigger. We were told by President Obama that Obamacare, your premiums will go down while millions of people go on, and we'll get rid of pre-existing conditions. Do not worry. And premiums have skyrocketed, tripled, quadrupled, and we're still in this mess. Let's hope there's a solution to this, because we're getting less coverage and paying more. And as always, on the taxpayers' back. Simple as that.
Okay.
And that's how you get to $38 trillion of debt. That's how you get into this position now where the government shut down, with threats from one side of the aisle on spending a heck of a lot more of taxpayer dollars. Insanity run amok as usual.
Let's get away a little bit from the shutdown aspect of it. Brian, we've talked about this before, which is that we've got problems in healthcare as a nation. We all agree on that. But somehow, when it comes to saying we want to dismantle Obamacare, let's say, for example, if you ever were to do such a thing, there is no alternative. There's no viable plan to solve some of the problems.
Democrats have won this so decisively. I hate to say it, but Obamacare is working exactly according to plan. The plan was never to bring down your premiums that you pay out of pocket. It was never to bring down health care costs. It was to get you on the government's dime for health care. And that's what it's done. Look, right now, Obamacare for the typical enrollee, 93% of the premiums paid by the government. If these little subsidies go away, that goes down to 80%. But
you mean the taxpayer?
Yes.
Yes.
80%, even if these subsidies go away, is still the taxpayer. Obamacare was designed to do what it's doing, to create the pressure it's creating right now on Republicans to say, oh my gosh, we can't make people's prices go up, so we better go along with the Democrats for another year or whatever. And the guys, the architects of this thing, Obama is getting exactly what he wanted. Government health care on the installment plan.
Yeah, I think what the Trump administration is doing, transparency everywhere, we can now measure this. We can bring this up and show what Obamacare has done, what costs have done since Obamacare came into effect, and figure out that it's not working for the taxpayer, as you point out. So I don't know what the exact answer is, and I don't know if anyone has the answer right now, but where we are right now isn't working. So figure out a way to do something different than what we have currently.
Another government program that started like this and turned into this.
Yep.
Well, and when Obama originally did, move forward with this, the whole thing was if you were going to walk into an emergency room and get emergency care and you didn't have insurance, that was going to end up costing the taxpayer. They always said it was going to cost the taxpayer more than it is now. I'd actually like to see that analysis,
no kidding.
because, you always do. This is how we started and this is where we are.
Yeah.